Urinary tract infections, or UTIs, are among the most common bacterial infections affecting millions of people worldwide. These infections can range from mild to severe, and although they are treatable, they require timely medical attention to prevent complications. The urinary tract consists of several key components: the kidneys, ureters, bladder, and urethra. When harmful bacteria enter and infect any part of this system, it leads to a UTI. Although both men and women can develop UTIs, they are far more common in women. UTIs are often characterized by symptoms such as a frequent and intense urge to urinate, a burning sensation during urination, cloudy or strong-smelling urine, and lower abdominal pain. In more severe cases, symptoms can include fever, chills, and nausea. These symptoms are caused by bacteria, often Escherichia coli or E. coli, which normally live in the intestines but can enter the urinary tract through the urethra, leading to an infection. Diagnosis typically involves a urine test, where a sample is examined for the presence of bacteria or white blood cells. A doctor may also conduct a physical exam to check for signs of an infection in the bladder or kidneys. Treatment for a UTI usually involves a course of antibiotics to eliminate the infection. Depending on the severity of the infection, oral antibiotics are typically prescribed. In more severe cases, intravenous antibiotics may be needed, especially if the infection reaches the kidneys. It's essential to complete the full course of antibiotics, even if symptoms improve, to ensure that all bacteria are eradicated and to prevent the infection from returning or becoming resistant to treatment. Prevention is always better than treatment. Staying hydrated by drinking plenty of water helps flush bacteria from the urinary tract. Additionally, practicing good hygiene, like wiping front to back after using the restroom, can prevent the spread of bacteria from the anus to the urethra. Wearing cotton underwear and avoiding tight clothing can also reduce the risk of UTIs, as it helps keep the area around the urethra dry and free from bacteria. It's also important to urinate shortly after intercourse to help flush out any bacteria that may have entered the urinary tract. Some people may also use cranberry juice or supplements as a natural preventive measure, though the scientific evidence on its effectiveness remains mixed. While cranberries may prevent bacteria from sticking to the urinary tract, they should not be considered a substitute for medical treatment. If left untreated, a UTI can lead to serious complications, including kidney damage or a bloodstream infection. Therefore, seeking medical care at the first sign of symptoms is crucial. With proper treatment and care, most people fully recover from a UTI. However, some individuals may experience recurrent infections, which may require additional tests or a different approach to treatment. Urinary tract infections are common, but with awareness, prevention, and timely treatment, you can protect your health and prevent complications. If you experience symptoms of a UTI, consult a healthcare professional